Hi there, this is Kelly Dean from the Tummy Team, and we're going to talk to you about the connection between the pelvic floor and the core. A lot of times we work both of them together because we are functional core rehab specialists and functional pelvic floor rehab specialists. They work together. The function of one affects the function of the other, and the lack of function of one affects the function of the other. So we have to understand how it all works together. This is the cool thing, is they're so similar. The groups of muscles that surround your core, as well as the groups of muscles that create the floor of your core, are very similar. Both groups, both the core muscles and the pelvic floor muscles, are primarily postural, structural, and respiratory in nature, which means your breath affects how they function. If you're holding your breath, they function differently. If you exhale and engage these muscles, they work better. There's a lot of correlation to how you breathe, how you stand, and how these muscles support your organs, your back, your spine, your pelvis. So they're structural and postural, which means they're primarily slow twitch muscles, which is kind of those endurance stabilizer muscles, not these big mover muscles, but kind of like if your bicep is a mover, your rotator cuff is the stabilizer. In your core and your pelvic floor, these muscles are mostly slow twitch, kind of long lasting, all day long muscles, right? Not meant for gripping, squeezing, pulsing, gripping, squeezing, pulsing all day long, although they do have the capacity to do that. Their main function is to hold you up, hold you together, and support structures. So there's 3 layers in both the abdominal wall and the pelvic floor. So in the abdominal wall, you have your rectus abdominis, that kind of crunch muscle, outer, so most superficial muscle. Then you have your obliques, which help with rotation and kind of side to side dynamic movement. And then you have your corset that wraps all the way around your transverse abdominis and really holds everything where it needs to be so all the other muscles can do what they need to do. In your pelvic floor, it's very similar. The outermost, most superficial muscles support the sphincters, and these are the ones that some people focus a lot on. The Kegel, kind of like the crunch, squeeze, 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 not necessarily the full function of the pelvic floor. Then you have the middle layer of your pelvic floor, which is a little bit more diagonal and dynamic in helping all of the kind of side to side, back and forth movements that happen in your pelvis and support your organs and structures at the same time. And then you have the deepest layer, which is your pelvic diaphragm, which actually holds your organs up so that they're not resting on those the middle and the superficial level. So it holds your bladder where it's supposed to be, and your intestinal tract, and in females, your uterus where it's supposed to be. So that there's kind of these layers in the core and in the pelvic floor to do their job. It's so much more about connection to these muscles, coordination between these muscles and each other, and between these muscles and the rest of your body, and consistency. Because these are all day muscles that's supposed to hold you together all day long, consistency is key. Doing a couple exercises here and there is not the same as learning how to connect and consistently use these muscles posturally in how you move and how you function. That is what we do at the Tummy Team. It is about that consistency, connection, and coordination that's going to help the functional level of your core and your pelvic floor. All right? So check out more of what we do at the Tummy Team.